a second.
Hi, everyone. Welcome back to the third episode of the Medeavors video cast. Today, I'm joined with another phenomenal physician in our midst. This is Dr. Shayla, and she is an OBGYN who practices in Bareilly in Uttar Pradesh in India. So, hi, doctor. Welcome to the show. Thank you so much for giving me some time. Um,
Hi.
Hi. So I'll start off by asking the basic question. Could you describe your specialty and what your day-to-day practice looks like?
Okay, my specialty obstetrics and gynecology. Basically, I have to describe it in one word. It is 24/7 call, right? So if a baby wants to come this way, that way, I have to be there. So it's a bit tough and demanding.
Great. A lot of, I think, credit goes to OBGYNs because you never know when, kids are going to decide, oh, it's my time, I have to come out now. So you always have to be on the ready for that. My second question is, there's, of course, this whole story about it takes a lot of years to become a doctor and it's a lot of work. So could you describe what your personal journey was like to become a physician? And if you could include both your education as well as your training post-graduation.
Okay. So it was basically my father who inspired me to become a doctor. He himself was a physician. So if I have to be very, very honest on this platform, I never wanted to be an obstetrician. Always wanted to be a physician like him.
Mhm.
But I studied from Aligarh Muslim University. There is, it's a central government hospital, medical college. So the patient load is like there is no count.
Right.
So when we were going for our third years and final year postings, it was like, my God, this is what we are made for. So
Mhm.
passion was generated over there. But
Mhm.
again, specialty remained the same. I wanted to be a physician.
Okay.
Then somehow our maternity postings, which were for about 10 days or so, I went inside maternity wards. They're the socioeconomic strata of the population that that is catered to in the government hospitals is not that good,
Mhm.
right? So government services are free. That's why they are coming there.
Right.
I saw the plight.
Mm.
I saw the plight. I saw the suffering of women that nobody was ready to hear to. In medicine wards, things were quite different. There
Mhm.
were male patients, there were female patients, and people were ready to, spend some money on them or give some care to them. But it was not so in obstetrics ward.
Mhm.
So it's at that time I thought of taking up obstetrics and gynecology as my specialty. And as you said, I should include my PG training also. It was awful. Initially, I used to, love heels. I used to dress up,
Ah.
religiously. Yes, I'll go like that. And, those dreams. Yeah, yes, now I'm a specialist now. I'll be training this way, that way. People will call me ma'am. Broken with dreams. And daily I used to go back and, soothe up my sore feet. And
Mm.
it was horrible, like long hours of working, standing. And it was not only me, everyone, right from
Mhm.
topmost consultant to an intern, we were working like the same. So
Mm.
but yes, learned a lot and learned nicely good things, and we're carrying that forward.
So I think that also answers my question of why did you choose to pick your specialty? And I think it's interesting how many students go in with this idea of, oh, I want to go into this specialty. Like I want to be a doctor in the future. I'm currently in 11th grade. So I keep thinking I'll go into neurosurgery because that really fascinates me. But I've heard from so many people once you do like your rotations or your postings in your third and fourth year, your mind can change pretty quickly. All of a sudden you decide, no, this specialty looks better. Maybe I should do this. So that was great. You covered that very well as well. So next is, this is a question that bothers a lot of students who are on the process of applying for a specialty. What are some factors that one should consider when they're making their choice?
Okay, first and foremost is your passion. What interests you more? You want to be a stethoscope physician, you want to be a scalpel surgeon, you want to be behind the curtain doctors, like doing radiology and making diagnosis, helping other physicians and clinicians, to do the stuff, or you want to be an anesthetist,
Mhm.
always like giving nitrous to the patient, and when they wake up, the things are done.
Mhm.
So you should know what interests you or what excites you, and whatever you choose should be born out of your passion. If you're not passionate, see, if you are choosing some specialty out of compulsion, I'm having these choices, maybe paraclinical, maybe preclinical, maybe some clinical branch. I think that forceful decision should not be there. So
Absolutely.
until unless you're passionate about some branch, I don't think people do justice later
Mhm.
on. Later on, they're just forced to see if I would have wanted medicine ultimately, and
Mm.
I would have been doing surgery. Maybe I would not have I have been performing that well, and
Mm.
vice versa also. So you decide, and as you said, those postings, those rotations, they're very very important part.
Mhm.
Like try to observe each and everything.
Mhm.
You are given an opportunity to visit each and every part of the hospital of medical college. You're
Mhm.
seeing your teachers also, because
Right.
the teachers who are teaching you anatomy, physiology, biochemistry, you see them also, you see their work, you see their commitment, and try to pick up from there
Mhm.
what looks the best,
Mhm.
and you'll get your answer. So always passion, and a bit of lesser of force, and
Mhm.
those kind of decisions that mom wants this, dad wants this,
Mm.
my sister is that, my brother is that, and maybe I'll get a good guy if I choose this specialty, maybe I'll get a good girl if I opt for this specialty. No, that should not
Right.
be there.
It should just be your decision, out and entirely your own. So the next question is a slightly interesting one. What is one specialty that you never considered specializing in? Like this was not an option for me.
Pathology.
I
I
see.
would have never ever touched that.
Pathology. Not very few people will say, "Oh, I really enjoy pathology." It is a
Mhm.
common answer I've heard when I've done other interviews. I always say, "Oh, no, not pathology."
Although
Um,
I'll tell you, it's very, very important. We are
yes.
heavily dependent on that branch, but for myself, no.
I mean, doctors rely so much on the lab work to like tell your patient, and they're the people who are like giving you the lab work results. But yeah, I agree. Not everyone's cup of tea to actually do um, that specialty. So next is, of course, there's a huge topic of the entrance exams in India for medicine. And so what are some tips you'd share for students who are not just preparing for the ones in India, but are preparing for medical school entrance exam in general?
Okay, so first, as I said earlier, also, it should be your choice to enter medicine,
Mhm.
and not your, because your parents are having a nursing home, your parents are practicing physicians, they're earning well. So those kind of things should not go. It should be your passion. And by passion, I don't mean that you should be working as a noble professional. You should not be thinking about money. Think of everything.
Mhm.
Think of everything. Think of even glamour in medicine also.
Mhm.
Even that is not, untouched over here. Doctors are so glamorous, so fancy, such cute people they are. So
Mhm.
if that fascinates you, then it should be a cup of tea. And second thing is, you divide your timeline, you strategize, try to waste less time,
Mhm.
because it's a common saying. Even I am a mom now, and I keep on saying this to my kids: study now so that you can enjoy later. I know there is no enjoyment, that kind of thing later on,
Mhm.
but yes, there is satisfaction later on. So if you waste less time at the time of your preparations, you will feel more satisfied when you have achieved what you wanted. So there is no dearth of wasting time. There is no dearth of, see, your parents or anyone who wants to see you at something good, right? If I would like to say, Miss Mazumdar, I want to see you as a good neurosurgeon in future. For that, you may take 10 years, take 15 years, take 20 years. Like, who is holding you back?
Right.
But earlier, the better, because it's ultimately a skill, the
Mhm.
surgery. More you practice, better you become.
Absolutely.
So it's kind of that stuff. So strategize, make your timeline, waste less time.
Mm,
That's it. And yes,
absolutely.
concentrate on your health, on your mental health also. It is not the end of the world. That is one thing, because you want to be a neurosurgeon. There are so many other things that must be fascinating you. It's just you don't know. So
Right.
if you don't get there as a doctor, there are so many other options.
Definitely. So next is there's a lot of emphasis placed on research and shadowing as a medical student. It helps you build a strong portfolio for the future. So what would you say your opinion is on those areas?
Actually, I myself is very much interested in research. I've published so many papers and so much of work. Anything different, I think, should be published,
Mhm.
should be told to the world that yes, this is also an evidence, so that next time, maybe after 10 years, you quote me that Dr. Jamal, she innovated this kind of thing. This is helpful, so let me adopt that. So research and mentoring, mentee, these processes are very important, because not everything is written in literature, not everything is, see, I may have certain things which I'm practicing which are good, but I have not put it down into a literature kind of thing. I
Mhm.
may be taking some certain types of suture which are very specific to me, and
Right.
over 15 16 years I've been using that. I find it extremely good. Maybe it's not in the books, but when you come to me as my junior and I'm teaching you, and I'm teaching you that way, so that also becomes very important way of learning. So it's
Mhm.
both kind of things, both are important,
Mhm.
and I really encourage it a lot.
Great. So the next question, I hate that I have to ask this because nobody likes to hear about it, but we are currently in the midst of our third wave. So how has COVID affected your practice personally?
COVID didn't affect my practice. I had to work during COVID. In fact, there are a lot of stories covered on my COVID work, and I'm glad people have recognized it too. So COVID had actually increased our work in the times of COVID, because everything else could have maybe waited, or it may have been delayed, but not childbirth, but not
Absolutely.
complicated pregnancies, not the need for cesareans, not the need for abortions or anything.
Mhm.
So we were actually there 24/7 during COVID also. I worked in first wave, I worked in second wave. There is no doubt that second wave was disastrous even for pregnant patients. It was not so in first wave. It did not affect my practice. It actually modified my behavior as a physician. I think I'm more passionate. I think I'm more understanding now, and I've seen so much in this in these 2 years. I don't wish to see that again. It
Mhm.
looks like an American scientific fiction movie, some Hollywood kind of thing. So I wish it does not come back. So that way it has affected.
And I'll also like to take this time to say, on behalf of I think everyone who watches or everyone who's around me, huge thank you to you and your work that you do. It's very difficult because you have a family of your own and you're always worried about what you might be bringing back home. But thank you for your work. I say this to every doctor that I interview. Words can really put your contributions and give them credit. But I think this is just something that I can do at this moment, and say thank you so much for your hard work.
So sweet.
So the next question, and this is also another interesting one. What is a stereotype about OBGYNs that you have encountered over the years?
Are you sure you haven't heard it before? Like,
I think I know what you're going to say.
so we are usually termed as most impatient people on the world, or always shouting on the top of their voices, always crazy, always wanting things to be done their way. And yes, impatience is the word that describes, or we are stereotyped that way. And another thing is regarding the looks of obstetrician also.
Mhm.
When you think of obstetrician, she is thought of as an elderly, loving, caring, motherly figure kind of thing. So
Mm.
there are to the world younger obstetricians also who do their job equally well. So obstetricians are usually stereotyped as ki someone big and elder. So younger generation is also doing stuff.
So next is, without giving any super close details, you can hide whatever you need to for patient confidentiality, of course. What is the rarest case that you have encountered in your practice, or something that was unique or interesting?
Mm, actually, so many, and many of them I have put across in various journals for the people to read and quote later also. So, for an obstetrician, finding out the rarest case, it was a young girl, huge tumor, and now everyone who is watching must be thinking it's not that kind of thing. That is like a young girl carrying a huge tumor, but it was her family circumstances,
Mm.
uh, you know, that baffled me more. She was pregnant also. So she had huge ovarian cancer, cancerous tumor with pregnancy. It had put us in a lot of ethical dilemmas, so many things, and pregnancy was also advanced one. So
Oh.
we had to, do so much of mathematics, legal mathematics, ethical mathematics, moral mathematics, and that human behaviors modified, manipulated. We had to tailor the treatment according to the needs and situations. So why I remember this case was because I was stuck in this case for around 20 days. So this
Mhm.
case was with me. We were discussing, we were following up, we were doing tests, and finally the outcome was good. So I
Oh.
can't tell the outcome, I can't tell what the treatment was planned, but yes, this young girl I can never forget.
Mm. So next, again, tackles a common stereotype about doctors in general, and that is there's no work-life balance. It's always work, work, work. When you're studying, it's always study, study, study. So how do you, since you mentioned you have kids as well, maintain a work-life balance as an OBGYN?
Okay, so currently I'm not doing my own practice. I'm a teacher in medical school, so I have a fixed kind of schedule, a fixed amount of rotational supervisional duties. So that has brought a lot of relief into my life. Otherwise, if you are doing your own practice, it's kind of 24/7.
Mhm.
So with the small kids, and my husband is in army, so we don't quite often stay together. He has to go, to his postings where we cannot always move along with
Mhm.
him.
Mhm.
So I have to stay back. I have to take care of kids. So this job kind of thing kind of suits me.
Mhm.
So yes, and regarding work-life balance, it's an overhyped thing. You can do anything under the sun. This is your passion, and for carrying forward your passion, you don't need any special tactics. You don't need any special, wings kind of thing. You don't need to be a superwoman. Just be a normal human being, normal mother who understands their kids, their needs. You can always improvise, and yes, take care of yourself first, because until unless you are not taking care of yourself, your kids will suffer in the long run. So think of your mother also. If she is ill, she really
Mhm.
can't help you much, but
Right.
when she is healthy, when she is happy, that will reflect on your face also, that yes, my
Absolutely.
family is kind of, good, we are good, we are well.
Okay, that was a very interesting take on it. And then another question is, so would it be right for me to assume that as an OBGYN, the most common cases you see are pregnancies and deliveries? Fair
Without
assumption, without a doubt. Do you generally, like, say statistically, see more normal deliveries or more cesarean deliveries?
Basically, I am in a tertiary care setting where patients are being referred from the drainage areas.
Mhm.
So we get to see a lot of complicated deliveries, rupture uterus, ruptured ectopic pregnancies, complicated case which are not being handled. And touch wood, I'm going to do a very, very different case tomorrow morning. Also, we were preparing our labs and OTs for that also. So yes, we do see like these things, but we concentrate more on natural birth.
Okay.
So I'll not call it normal delivery. I always call it as natural birth. We always give preference to that until unless there is an indication. I never ever go for cesarean, because I myself had two cesarean deliveries, so I know the
Mhm.
after pain. So
Mm, yeah.
natural birth is always better.
My mother had the same thing as well. It was kind of an emergency in my case. So yeah, I agree. She always says a natural birth would have been so much lighter on her body in terms of the recovery process because they lived abroad, so they didn't have any family support. So she was like, it was so bad trying to, recover quickly and get back to things. I definitely agree with that. That brings us down to the final question, and that is, what is your advice to students who either wish to go into medicine or those who are currently at any stage of becoming doctors?
Mm, enjoy your life. Enjoy your life. Things, they're coming your way. So some things do come really in a planned way, like you've done your school, you have done your, like in India, we do intermediate school also, and then you go for uh, pre-medical test entrance examinations also.
Mhm.
So try to give your best if you want to go in there. But as I said earlier, also, this is not going to be the end of the world. I thought if I would not have been a doctor, I would have been an actor, I would have been a director. And that's what I realized quite late in my life. So I've started doing everything. I've started hosting TV shows. I have started anchoring TV shows. I am into fashion shows. I'm into hosting fashion shows. And yes, I have started social work also. I have started an NGO also. I am doing everything under the sun. So first thing is, if you really want to be a doctor, uh, be ready to sacrifice what other people are not sacrificing,
Mhm.
and don't crib about it that we are sacrificing it. Nobody asked you to become a doctor. It
Right.
was your passion. So
Right.
enjoy your passion, enjoy your life. Second thing is, when you have sacrificed certain things, feel privileged also that
Mhm.
God has given this, kind of opportunity to you so that you can sacrifice so many things but earn other things.
Right.
Like Miss Mazumdar just thanked us, the doctors. So I really love that, and those kind of gestures, and that's what the things that make us living and lively. And third is, if you are a doctor, never ever think that you're not going to do anything else apart from being a doctor. You can be a singer, you can be a cook, chef, pro, you can be a photographer, you can do dance, you can do anything. So you can do anything, everything along with medicine. You just should have that metal in you.
Also, since you mentioned an NGO, would you like to share some details with our audience so they can know a little bit more about what you're doing?
Okay. So I am I'm founder and president of Society of Menstrual Disorders and Hygiene Management. So I'm concentrating on the menstrual hygiene, those taboos, myths, issues about menstruation, especially in India. And I will not say it's prevalent in rural India, it's prevalent everywhere. Inside us also, I had to take out that thing so that I can take forward this cause. So it is everywhere, it is in everyone's mind, something or the other related to menstruation. So it's my uh, passion to create awareness about menstruation, to increase menstrual safety, increase menstrual education. And I have started a movement which is going to culminate on 24th of January. That's National Girl Child Day over here. uh, that is a movement for dignified menstruation in girls. So dignified menstruation is my right. So that's what I want to profess and propagate.
That's lovely. So I'd like to say a huge thank you for making time and adjusting with my many rescheduling requirements. I'm really sorry about that. But thank you so much for joining me today. I'm very glad that you could make time. I'll pause the recording now. If you could just hold back for 1 minute,